Hamza and Fatima live in Dandenong, a suburb of Melbourne, and have 2 children, Parween and Zahar. When they lived in Afghanistan, they feared every day that violence would tear their family apart. Hamza and Fatima wanted to give their children the best life they could, so they made the dangerous and expensive journey to Australia 2 years ago. Hamza now works hard in a restaurant. Fatima stays at home and looks after the housework with help from little Zahar. Like his father, Zahar has lots of energy. After Hamza has gone to work and Parween to school, Fatima cleans up and usually lets Zahar dry the dishes. But today, her little helper doesn't show up for work. Fatima finds Zahar in his room. He has a high fever and is restless. She asks him what's wrong, and he says he doesn't feel well. Fatima phones Hamza, who tells her to make an appointment to see a GP. Without an appointment, he says she may not be able to get in. He tells her there is a brochure with information on what to do. Fatima is worried about the cost, but Hamza tells her to take in the Medicare card and healthcare card, which are kept in a safe place in the kitchen. He tells her the cards are for the family and will make the doctor's appointment cheaper. Because Fatima's English is still poor, she phones the number for an interpreter, which is on the brochure. The interpreter connects her to the doctor's clinic. Fortunately, Fatima is able to make an appointment for later that day. On Fatima's request, the receptionist also arranges an interpreter for when she sees the doctor. Interpreters can be available over the phone or in person. The receptionist confirms Fatima's appointment time. At the doctor's clinic, Fatima checks in. The receptionist takes Fatima and Zahar's details and asks to see her Medicare and healthcare cards. When the doctor is ready, they go in. The doctor assesses Zahar and through the interpreter listens carefully to what Fatima says. The doctor tells Fatima that she will need to get some medicine from a pharmacy. The doctor gives Fatima a prescription so she can buy the medicine. On the way home, Fatima stops at a pharmacy where she hands the lady the prescription. Fatima is confused about why she needs the prescription because there seems to be lots of medicines on the shelves to buy. The lady explains that in Australia, strong medicines like the one Zahar needs can only be provided if a doctor requests it. She says that the medicines on the shelves are basic medicines and so are safe for most people to use without a doctor's permission. After 5 minutes, the medicine is ready, and the pharmacist tells Fatima what time to give Zahar the medicine and how much she should be given. The pharmacist tells Fatima that it is very important that she follows the instructions carefully. She also reminds Fatima to ask a pharmacist or GP if she is ever unsure about how to use any medicines. With the healthcare card, Fatima is able to get the medicine a bit cheaper. Back home, Fatima gives Zahar the medicine and puts him to bed. Fatima has made some dinner and asks Parween to serve it to Zahar. Parween agrees, joking that her little brother had better not get used to having a servant.